The ability to get genetic or genomic information into our treatment of patients has been on our strategic plan since 2010. Did we know exactly how that was going to look like? No. But we know that patients' health is broken up basically into three buckets, right? We've got social determinants of health, we've got the things that we do, and then the third box that's never been unlocked has been, in many ways, is the genetic, what we're born with, what our parents gave us. And so, that's the piece that we've been missing. We knew we'd have to incorporate that somehow. We can optimize our care. We can't change our genetics, but we should know what the genetics are.
Genetics at St. Luke's, it's our mission. St. Luke's is a health organization, and our job is to get those communities healthy. We've always been reactive at St. Luke's. We wait for sickness to come to us. We then do some genetic testing, or we may have some family members, and then those individuals come to us for testing. This is an opportunity for us to go on the offense in the context of getting our communities healthy, and we're going to do that based on expanding our genetics program.
How does a health system like ours, we're a modestly mid-sized to large health system. How do we get into this space? We don't have labs that do genetic sequencing. We don't have data scientists around that need to be doing some of this stuff. And how do we get in this for our patients? So you partner, right? And so you partner with an organization that can do that.
And at St. Luke's, we've decided that we're going to partner with experts, partner with people that may be on the forefront of sort of heading in a direction that we want to be, versus building out that infrastructure ourselves.
There's been just tremendous support. I have not met one clinician that thinks this is a bad idea. I think the genetic space right now is where Amazon was when they sold books. We had no idea what Amazon was going to look like 10 years later, right? When you can get toothpaste in 6 hours at your house, right? I mean, who would know? We don't know what this is going to look like in 10 years for genetic testing. But what we do know is that this area is exploding. This is an investment. It's an investment we're making now so that as this information comes out, not only are we ready to deploy it, we're actually ready to make a difference for patients when that happens.
The conversation over a period of a few weeks transitioned from how are we going to do this from, not just resources and how are we going to pay for this, to how can we afford not to do this? I don't think it's a matter at this point of if and this is something that's going to happen with the U.S. healthcare system, implementing genomics and genetics into the clinical space. It's a matter of more looking at when the time is right.
In my mind, this is the time to start investing in that. And then, I see our ability to really tailor therapy. So as somebody comes into our hospital system, comes into our emergency room, can we tailor drug therapy? Can we tailor, what type of medicine they're going to be on? That's going to be the value, down the road for the patients. Once you have that information at hand, and once you have that in the electronic health record, we can keep accessing that information back over and over and over again for when you need it.
So when Helix approached us, it was a matter of giving us some structure in getting to where we want to be in the next 3 or 5 years, which is defining and then connecting what our precision medicine program is to our population health and the communities in which we serve.
So what I see Helix doing is sort of providing us that entry into the space. The other part of this is being able to cohort data, right? So we know that having, even the largest health system in the U.S., Kaiser, as an example, they don't have enough patients to make a statistical difference in what genetic information is going to be able to give us. You need to cohort probably a few million patients over time to really start getting more and more meaningful data. And so, that's the power of this thing. And so we just see this as another way to provide quality care and continue to improve the quality that we give, not just to our individual patients that we have in our hospitals, but also out in the community, the people that we don't know that are sick and that may be getting sick later.